Well, how you doing today?
I'm good.
You're just gonna be doing. I'm doing good. I'm just gonna be doing a little head to toe assessment. Just make sure everything's okay today. I'm gonna start by getting your blood pressure.
All right. I'm getting comfortable.
Get comfortable. Okay, put this on. Having some technical difficulties with that. Oh, I'm so small. Is that comfortable for you?
Yes.
Can I see this pillow? Just want to make sure I'm good. Okay. See, that's why you shouldn't, when you be a nurse, you should just have your hair up so, you know, it won't get tangled in the hair. Okay. Yeah, that's.
You're pretty close.
Yeah, thing going down. Okay, I just want to read your pulse first. Okay. Okay, and I'm gonna pump it up one more time, just to get. Everything looks normal. Got 118 over 80. Sorry. I want to check your temperature.
Okay.
Okay. Stick your tongue down. Okay. Okay, 98.2. Alright. I just want to check your pulse. Make sure everything's okay. Okay, your pulse and your respiration look good. Everything looks good. I want to just look at your skin. Just make sure everything's okay. Look at your color, your temperature. Check your skin color. Okay, everything looks good. I want to look at your nails. Make sure you don't have any lesions or anything. Check your capillary refill. Okay, that looks good. Did you put your Okay, I'm just making sure that your nail bed is at least 160 degrees. Okay, and I want to look at your hair. It's really pretty. I love your waves. I'm just making sure that you got a lot of luster and that it's even and distributed throughout. I'm gonna inspect your scalp, just looking, noting that I don't see any lesions or bumps or anything, and then I'll just gently palpate it, just make sure everything's okay. Everything looks good. Now I want to inspect your face, just looking at your skin, making sure your eyebrows and your palpebral fissure, everything is symmetrical and everything is good. Did you smile? Good. I like your smile. That's I'm just testing your cranial nerve number 7. That's your facial nerve. Could you frown for me? Okay, cool. I just want to like gently palpate your face. I know my hands may be cold. Sorry. Just make sure everything's okay. And while I'm doing that, I'm doing your sinuses, your frontal, and your maxillary. Everything looks good. Could you clench your jaw for me? I just want to feel your temple down. Okay, everything looks good. I want to give you this cup of water. Could you sit up for me? Just want to look at your swallow. Check your neck. Make sure everything's okay. Okay, everything looks good. Now, could you swallow again? I want to do your just your thyroids. Hold it for a second, and now you can swallow. Okay, everything looks good with your thyroids. Now I want to check your trachea and just make sure everything's okay. Looks good. Okay. Then I want to auscultate it with the bell, so make sure that I don't hear any bruise or anything. Do it with the bell. That's your carotid. I'm just doing that as well. And then your temporal. Okay. Want to look at your lymph nodes. Okay. Just make sure everything's okay. You're fine. Your periocular, your postocular, your occipital, your retropharyngeal, your deep cervical chain, your superficial, your infraclavicle, supraclavicle. Yeah, everything looks pretty good. Could you move your neck for me, short it to your shoulders, like this? And could you do the other one? Could you push your head to my, okay, and to the back. Okay, and that's just testing your cranial nerve number 11. That's your accessory nerve. Okay, now I want to move on to your ears. Just want to inspect them. Make sure everything's okay. Look at your articles and palpate your tragus. I see you got your ears pierced. You have no problems with that, do you?
No.
Okay, I'm just going to pull up and out so I can look inside. Okay, good. Everything looks pearly gray. Up and out. Okay. Could you stand up for me? Just want to test the guy with your balance. Could you do just walk so I can just see? Okay, everything looks good. You can sit back down. Now I want to perform the Weber test on you. Just tell me when you can no longer hear. It should be even in both of the ears.
Okay. Okay.
Okay, cool. That's good. Then I'm gonna hit it again, and I'm gonna put it on your vascular process, and just tell me when you no longer can hear.
Okay.
And then I'll put it in front of you, and you just tell me when you no longer can hear.
Okay. Okay. Okay.
Okay, good. It was twice as long, so that's good. Now I want to look at your eyes, and I'm just gonna inspect them, make sure everything's okay. Look at the light. Okay, everything looks good. Look at your left eyes. Then I'm gonna test you for accommodation, just to check your perla, make sure everything's okay. So could you stare at something behind me?
Okay.
And could you turn around for me? Yeah. And I want you to stare at something behind me and then look at my pen light. So just stare at something behind me.
Okay.
Then now look. Okay, then behind me on this side. And then now look. Okay, good. It looks like your eyes are accommodating well. Now I just want to check for your extraocular movements. It's gonna be like a H test. So just follow my hand whenever you see it. Well, follow my hand, the light with your eye. Okay. Okay, everything looks good. Um, just want to do a point. I'm gonna shine the light on the bridge of your nose, and I should just be able to see the reflection. Okay, cool. Everything looks good. And could you stand up for me? Okay, and just cover one eye, and just tell me if you when you see my hand coming.
Okay.
And do it in the other.
Okay.
Okay, cool. Everything looks good in your eyes. Now I want to put my hand on the bridge of your nose, and I'm just checking to make sure that everything is okay with your peripheral vision, and just and see. Okay. You tell me when you get close to you.
Okay.
Okay. Cool. That's good. Now, I want to look at your nose. Just want to inspect your nose. I don't see any lesions or anything. It don't look like your nose ever been broke. You have any problems with your nose?
No.
Okay, I just want to check for your make sure you don't have any deviated septums, and I want to check for the patency of your nares as well. I just want to like palpate it, make sure everything's okay. Everything looks good. I want to look at your septums, making sure everything is okay. Okay, and could you just breathe? Okay. Okay. And I want to perform a smell test, and this is going to test your cranial nerve number 1, which is your olfactory. And just close your eyes and tell me, what do you smell?
Okay, vanilla.
Good job. Okay.
Cinnamon.
Okay. Now I just want to look in your mouth. Get a pen light. I want to first just palpate your lips. Just make sure I don't see any bumps or anything. Everything looks good. Give me a tongue blade. Okay, then you open your mouth. Just look and make sure your teeth are intact. I don't see any cavities. Everything looks good. Your uvula looks good. And that's your cranial nerve number 10, which is your vagus. And I see your Spartan duct and your Wharton duct. Everything looks good. And your gag reflex, that is be your cranial nerve number 9, which is also pharyngeal. But I don't want to irritate you today. Okay. So now I want to I'm just going to look at your thorax. Make sure everything's okay. Looks good from the side. Could you stand up for me? I just want to make sure that your transverse process is 1/2 of your AP. So, looks good. Everything looks good.
Okay.
Okay?
Sorry.
Could you pull your hair to the front? Just want to listen for some breath sounds. Listening for your tracheal, your bronchial fascicular, and then your vesicular. Okay, you can sit back down. Now I want to listen to your pulses, your radial pulse. Okay, your breathing. Your pedis. And your posterior tibia. Okay. Everything sounds good. Let me see. What should I do next? I would ask that you stand up. Wanna make sure that your lungs are expanding. So could you breathe? Okay, everything looks good. And when you feel my hand on you, can you just say 99?
99. 99. 99.
Okay, good. You can sit back down. Okay, let's see what I want to do next. Okay, I want to, could you lay back down? I want to, locate your heart valves. This is your aortic, your pulmonic, and at this level, we like for your S2 to be greater than your S1. And at this point, this is your herbs point. Okay, and at this point, we want everything to be greater. And then you have your tricuspid. Gloves don't look stick. And then your mitral valve. And at this point, S1 should be greater. Okay. And I just want to Okay. I just want to auscultate and listen to those valves. Okay. Everything sounds good. And then I want to move on over to your abdomen. And I just want to inspect it, make sure everything is okay, looks okay. Then I want to divide it into 4 quadrants. And you have your right upper, your left upper, your right lower, and your left lower. And I just want to listen to vowel sounds in each 4 quadrants.
Okay.
And while I'm doing that, I just want to auscultate your arteries. You got your aortic artery, your renal, your iliac, and your femoral arteries, but we're not going to do that today. Okay. Now I just want to percuss all 4 quadrants. Just make sure everything's okay. Okay, everything sounds good. And then I want to I just want to check your liver, make sure everything's okay. Get the tape ready. I'm gonna come up until I hear dull sound. About right there. I'm just gonna measure it. Yeah, it's fine. Measure it. You're just a small girl, so you're gonna have a small liver. And now I just wanna do your spleen. Make sure everything's okay on that side. Okay. And I just want to palpate everything. Deeply palpate everything. Make sure everything's okay. Everything seems fine. Okay. So that's your abdomen. And now I'm gonna move on to so what I'm gonna do. Your neurological. Okay. So throughout this exam I've been doing some working on your cranial nerves. I just wanna reiterate them. For your cranial nerve number 1, that's your olfactory, and that was when we did this smell test. And then cranial nerve number 2 is your optic, and I was doing your vision. And 3 and 4 are 3 is your oculomotor, and 4 is your 3 is your oculomotor, and 4 is your trochlear. And those both do your vision test, like the H test, what I did earlier, and so does 6, which is your adducent. 6, which is your adducent, yeah. 5 is your trigeminal, and that's just like when you clench your teeth. So I made you clench your teeth when I did your temporal mandible control. Okay, 7 is your facial, and I did that when I was made you smile and frown. You did a good job, got a pretty smile. And 8 is your trochlear. Yeah, and that is with your that helps with your balance. Yeah. Number 9 is your glossopharyngeal, and that's just like your gag reflex that I told you I didn't want to do today. And 10 is your vagus, and that can be with your uvula or your gag reflex. 11 is your accessory, and I did with your neck, and you got good neck muscles. And 12 is your hypoglossal, and that is the tongue. Yeah, stick your tongue out, poke it out through your cheeks and all that. Okay, so I just want to orient you and make sure that we're on the same page. So what is your name?
Anna Wilk.
Okay, and where are we?
Nursing building.
Okay, what's today's date? It's been a long day.
April 17th.
April 17th, okay. Can you tell me when is your birthday?
June 1st, 1994.
And can you tell me who's the president?
Barack Obama.
And I'm just going to give you 3 words for you to remember, and then I'll ask you to decide.
Okay.
And that's laugh, live, and love.
Okay.
Okay. If you was in a burning building, what would you do?
Pull a fire alarm and go to the nearest exit.
Okay. Good job. What have you seen a mail on the ground with a stamp on it? What would you do?
Take it to the nearest mailbox and send it.
Okay. Now, what was those 3 words that I asked you?
Live, laugh, love.
Okay. Good job. I just want to I set your gait when you walked in. You walked in, balance seemed fine. So could you stand up? I just want to see you do what we call a tandem walking. It's just kind of just like a heel to toe. I just want to see you walk. Okay, everything looks good. Could you sit it right there at the bed for me? Okay, I just want to test some of your upper extremities. For your upper, I'm gonna see you do supination, pronation. You just do your hand like this. Supination, pronation. Okay, cool. And for your legs, could you draw like a figure 8? Would you? Okay, good. Feels kind of crazy. Okay, cool. Now I want to see you. What do I need to see you do? I'm gonna touch you, soft touch, it's sensory, and I just want you to tell me when you feel if I'm touching you or not.
Okay.
Okay. And I just want to do something that we like to call sharp touch, dull touch. So just tell me if you feel something sharp or dull touching you.
Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay, good job. And we're gonna do something we call stereognosis, and that's when I I put something in your hand and you tell me what it is. Close your eyes, okay?
Keys. Cotton ball.
You don't like cotton balls?
No.
Okay. And this is I'm sorry. This next step is called graphesthesia, and I'm gonna draw a figure in your hand. You just tell me what it is. Okay. It's gonna be a letter.
X.
Okay, and this one's gonna be a number.
3.
Okay, good job. And then I want to do point localization. You just tell me what I'm touching, what part of your body I'm touching.
Okay. Arm. Thumb. Lower leg. Ankle.
Okay, good job. And now I just want to check for some reflexes and make sure everything is good. You want to do your triceps?
Okay.
Which one? Okay. Just make sure everything's good. Just relax. Okay, good job. Do this one. Okay, good job. Then I want to do your radial. Okay, good. And could you turn around? I want to do your feet. I'm sorry. The correct term for that is Achilles. So just okay. I'm sorry. Okay, cool. Now I want to do your patella. Just make sure your knees are okay. Oh, I think it's the pants. Okay. Oh, I'm sorry.
Oh, that weird.
Okay, and everything's cool. Now I just want to test your range of motion. Could you put your hands up like this? Okay, put them down. Okay, cool. Good job. Could you move your legs? Okay.
How?
Could you push it forward towards me? Okay. Good job. And come behind you. Could you push your arm towards me? Okay. All right. Everything looks good. Trying to think. Make sure I'm not doing anything. Gonna refer back to my notes just for 1 second. Okay. Can you stand up? Just want to look at your spine. Make sure everything's okay. Looks good. Okay. Everything looks good with your spine. Yeah, everything looks good with your spine. You can sit back. Okay. Since you're on musculoskeleton, I just want to make sure you can move all your joints. You move your wrist, everything moves good. All your fingers, you don't have any problems with moving anything. Elbow, everything works good. Okay. No pain while we're doing this, right? And you move your leg, everything is cool. Yep. Alright. Good job. And that, I think I'm pretty much done with everything for today. Everything looks good. You got a good, clean bill of health. So, thank you.
Thank you.